On today's episode of the St. Louis Pain Expert Podcast, I'm talking with Dr. Asia Muhammed, a naturopathic doctor who specializes in the gastrointestinal system, about all things GI and how they affect your general health, your anxiety, depression, pain, and many other things. I think you're going to get a lot out of this episode. And if you do, subscribe to our podcast so you get notified of future episodes. And now, on to the show.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I have with me here today Dr. Asia Muhammed, a naturopathic doctor who specializes in gastrointestinal problems. And it's great to have you here with us, Asia.
Thanks for having me on. I really like your show.
Well, thank you. First of all, can you tell us just a little bit about what a naturopathic doctor is? A lot of people may be unfamiliar with exactly what it is.
Totally. So a naturopathic doctor is kind of what it sounds like more natural, holistic protocols to look at and treat disease. So naturopathic doctors attend a 4-year naturopathic medical college. And the first 2 years are really similar to like an MD or DO program in that we do our gross anatomy lab. You have your core sciences. And then the last 2 years, we focus more on clinical rotations, but they're focused around naturopathic modalities like food and botanical medicine, herbs, supplements, IVs, and just the whole gamut of modalities that naturopathic doctors use.
So that really is pretty similar in education level to like an MD or a DO.
Correct. Yeah, it is. It is.
So you said you specialize in the gastrointestinal system. What are some of the common GI problems that you see in your practice?
So I see a lot of like IBS, IBD, so constipation, diarrhea, a mix of both. And then I also see inflammatory bowel disease. So those are the Crohn's colitis cases, like chronic gas, bloating, acid reflux, everything from the top to the bottom I've seen for the most part. I mean, even down to hemorrhoids and anal fissures. So I see pretty much everything GI.
Now, how would someone know that they have a GI problem as opposed to, oh, I just have a little indigestion or I have some gas or something like that?
It becomes a problem when it's chronic, right? So the chronicity of a symptom may point to some underlying issue. Like if you're just bloated, when you eat a specific food and you can attribute that to that food, there's probably just some sensitivity there, issue with maybe what's in the food. But if it's like a chronic issue and it occurs across a spectrum of different items or like foods or environmental exposures, and it's triggering these GI symptoms, and maybe an underlying chronic issue. So a lot of people that I see, like they've seen multiple gastroenterologists and they've tried tons of meds and they've tried tons of supplements, and nothing's worked for their chronic GI issue.
Now, these people who have seen multiple specialists, what do you do that's different from some of the other people that they've seen in the past?
Totally. So first thing I do is kind of use some type of objective stool testing. And so there's a few big ones out that people love. You hear a lot about GI map, which is a great test. And I don't work for the company, just so you know, I'm not like plugging that, but a lot of people are talking about GI map in social media circles. And I have people reaching out to me on Instagram about these tests. But one thing I do is like some type of objective stool testing for patients with chronic GI issues. And so, a lot of times, just because I've seen like literally thousands and thousands of GI patients over the past, few years of me practicing, I can sometimes pinpoint specific cases, like what underlying causes may be. And I won't really do any testing. I'll just say, go pick up this and dose it at this amount. And if it makes a difference, then we're on the money. We're spot on in what I'm thinking it is. But if that's not the case, and I think, well, I'm not sure what's going on based on some of the symptoms that they give me, it doesn't really stick to anything, I'll then say, well, let's consider some type of stool testing to see if we're missing some underlying parasite or overgrowth of yeast in the gut, or bacterial dysbiosis that's really, wreaking havoc on the system.
And you mentioned kind of using treatment as a form of testing, that if the treatment works, it might be that problem. Most of your treatments are pretty non-harmful, that if you try eating a food or try taking a vitamin or something, it's not like a medicine that might have a lot of side effects.
Exactly. Yeah, I had this case this past Saturday actually, and chronic diarrhea, and nothing made a difference. Seeing multiple gastroenterologists, and did not want to take any antibiotics and it wasn't like a acute gastroenteritis. So you have sometimes like these acute GI bugs, and they typically are self-limited. So they go away on their own after a week or two. But this is like chronic years-long issue this person had. And they were never given any type of enzymes. And so when I hear certain symptoms around diarrhea or loose stool pictures, it makes me think of something called EPI, exocrine pancreatic insufficiency, which is not really common in the population, but the treatment is extremely simple. It's literally adding in specific pancreatic enzymes. And if the diarrhea goes away, then that's what it is. And so for this person, I just say, go to the store, get some of these enzymes, dose it at this amount. If in a few days your diarrhea goes away, then it's likely pancreatic insufficiency. So the unfortunate part is a lot of GI doctors miss these kind of lower hanging fruit because they're doing colonoscopies and taking biopsies and like, oh, well, there's no inflammation. You're not colitis or Crohn's, which is autoimmune disease. So, you have IBS, which IBS is just a diagnosis of exclusion. It means we don't really know what's going on, but you're not dying. So here.
Yeah, it's interesting you mentioned that. I mean, obviously, I don't work with the GI system, but sometimes the simplest treatments are the most effective ones.
Yep.
And when you look for the complex problems, sometimes you overlook just the very simple things.
Mm-hmm. Yep, you're right.
Now, in the last decade or so, there's been an increased awareness, both among the medical community as well as in the public, about gut health and the gut microbiome. Can you describe what the microbiome is and what role it plays in your health?
Yes, I love the microbiome. Microbiome is our bacterial, makeup in the gut. And there's literature that was saying we have more bacteria in the gut than we have body cells. And now they're saying maybe that's not true. Maybe we have just as much bacteria in the gut as body cells, or a little bit more. But your microbiome in the gut specifically, because you have a lung microbiome, which is actually kind of similar to the microbiome in the gut as well in terms of bacterial makeup, but you have tons of bacteria in your intestinal tract. There's 3 to 5 pounds of just bacteria in our gut. And they have specific functions and specific roles in creating and helping to create neurotransmitters like your GABA, your serotonin, which are your happy, feel good brain chemical or neurotransmitters, I'll call them. GABA, which is like a neuroinhibitory one. So it calms you if you're anxious. That's one that's produced to help calm us down. Bacteria in the gut can produce that. They also are can be inflammatory and anti-inflammatory. And so, there's so much potential for focusing on therapies related to the microbiome. And there's a lot of literature now around the microbiome related to pretty much every chronic disease that exists.
You mentioned serotonin and GABA, and those are highly related to both anxiety, depression, and pain processing. Can you tell how some of those chemicals affect both pain processing and depression?
Yeah, I mean, when you look at the microbiome, right, we think there's so much literature linked to anxiety, depression, and the microbiome. And we think it has something to do with these neurotransmitters, and then also with just kind of other chemicals that the microbiome may produce. And when you look at studies around people who take, for example, antibiotics, I think it was a number of 6. If you've taken 6 antibiotics over the course of your life or more, you are kind of in the highest risk category for relative to depression. So it's just interesting showing how just nuking the bacteria in the gut consistently can negatively impact our mood response. So that's anxiety, that's depression. Also, I'm not specifically sure, honestly, in regards to like pain, like gut microbiome dysbiosis and pain, to be honest with you. I've not really read a ton of literature on chronic pain and dysbiosis, just knowing like chronic pain patients and how they typically present. I mean, I would imagine there's a ton of dysbiosis there, but I don't really know anything specific to chronic pain. Do you know of anything related to that?
Well, it is really common, in the chronic pain population. If you dig into it, a lot of them do have digestive issues, either IBS or things like that. Anxiety and depression are hugely related in a lot of cases of chronic pain. And serotonin or 5-HT, which you said is one of the main neurotransmitters produced in the gut, is highly linked to pain processing as well. So it's really interesting how those all kind of fall into alignment.
Yep, it is. And there's, chronic pain is like a huge complaint in America now. I'm not sure if it's like in terms of like leading issues, reasons why people see the doctor now, but there's so much chronic pain across America. And I actually know a doctor here who treats a lot of chronic pain, and they're kind of like, what else can we do? What other tools can we add to our toolbox? Because they're a conventional doctor, right? And they're not really sure where else to go, and they will send them over to me. And I work a lot with the gut in these patients as well. But that was a side note. Sorry.
No problem. So what are some simple things that people can do on their own to improve their gut health?
So the biggest thing I always recommend is just kind of what we put in our mouth, because we have to eat. So, in order to change your gut microbiome, you have to consume some type of fiber. The bacteria in your gut need fiber. They metabolize and break fiber down and produce these things called short chain fatty acids. It's kind of like your car needs gas to run. Your colon cells need short chain fatty acids to run. And you find across like populations who have like IBD, Crohn's and colitis, they have issues with like short chain fatty acids in the intestinal tract. And I'm not sure if it's necessarily an issue with making them, like the bacteria is not there to break them down, or if it's an issue with their cells being able to actually take up the short chain fatty acids. But you find that an issue there, and like colitis, Crohn's, you find issues in IBS patients. So for me, the biggest like takeaway for patients is like the first thing you got to do is make sure you're eating fibrous foods. And the simplest way I have patients do that is to make a smoothie and just blend stuff up if they're not like interested in cooking a lot of stuff.
There's been a lot of talk about probiotics and prebiotics, and can you describe first of all the difference between those, because some people may not know, and then when something like that may be needed over just eating more fiber and getting more fiber in your diet?
Yeah, so the difference between prebiotic and probiotic, I always describe it as like a garden. So if you have a garden and you put new dirt in your old dirt, that's probiotic. If you have a garden and you're putting fertilizer in your old dirt, that's prebiotics. So the prebiotics help to feed and grow what you already have. Probiotics pretty much is like a new, it's not replacement, but it's somewhat like a replacement for the bacteria you have. So you need a little bit of both. When I see patients, I always advocate both, like the pre to help grow the pro, and then help support what you already have there. And then your second question was, when would you need them?
How would you know that you need that beyond just getting more fiber in your diet?
So I don't know if you necessarily would know unless you're actually like have a severe GI disorder. So for patients that I typically always say, I always put on probiotics for like the Crohn's colitis group of people, just because there's like a lot of positive literature around probiotics in that population. So that population is one that I wouldn't necessarily put on high fiber diets, because if their colon or small intestine is already really inflamed, fiber can be a little rough in the intestinal tract and it can make things worse. So you'll see a lot of colitis patients doing like low fiber diets because fibers really tear up their intestinal tract. And I shouldn't use the word tear, it's a little visual, but there is too much roughage on their intestinal tract. So I will sometimes, all the time, for in cases like IBD, I'll always recommend really high dose probiotics. And then outside of that, people who, I think that for the most part, any kind of chronic GI issue, I'll always add in some type of probiotic, because I just find that patients aren't really able to get in, and they can, but they just don't get in the recommended amount of fruits and vegetables every day. And it's a lot if you go from not really eating fruits and vegetables to having to try to get 5 to 9 servings in a day. Like you have to titrate fiber up, because if you don't, it'll make you really bloated. So I hope that answers the question.
Yeah, that was great. Other than dietary things, are there any other sort of lifestyle management things that people can use to help improve their gut health or decrease gut dysfunction?
Yeah, I recommend a ton of like mind-body protocols. I'm really big into hypnotherapy and guided imagery. So I will do like hypnosis or guided imagery scripts for patients who have like really bad tummy pain, or more so for just kind of like abdominal discomfort, abdominal pain. I'll do some scripts for that. I mean, visualization is a powerful tool. So that's one that I use. I mean, outside of probiotics, diet, I also use like certain botanicals, like herbs that are really good for GI function. I love peppermint for any type of kind of bloating and like more bloating, honestly, than lower abdominal area. So I'll use peppermint often. I'll use chamomile. I use fennel for excessive gas and bloating. I use berberine for like bacterial things related to the gut. So I love recommending botanicals whenever I can. I've used homeopathy with success in one case when I was in residency. It was a wild case. And I don't use a ton of homeopathy just because I don't. There's no particular reason. But I remember I had this lady. Do I have time to tell this story?
Absolutely.
Okay. Yeah. Just rambling. So I had this lady who she had chronic opioid-induced constipation, and she was like on a fentanyl patch, and I don't forget what her chronic pain was. It was like back or what, but she was on this like this pain patch because the pain was just so intense. And as you know, the number one side effect of those things is constipation. And she could not go to the bathroom, and she was like on her own without the like use of like medical support to produce a bowel movement, because they had medications at the time for people specifically with opioid-induced constipation, but she was taking those. But if she wasn't taking those medications, she was going to the bathroom like once a month, if that. And when she did go, it was like little bitty rabbit pellets. And so I remember this lady because I was just so shocked at this case. And so the doctor that I work with, he was a gastroenterologist. He had no idea what to do. He was like, well, she's on the medication. I don't really know what else to do. So he's like, Dr. Muhammad, come in here and help her out. And I'm like, I have no idea what to do either. So I had this homeopathy kit. And I remember this homeopathic remedy for somebody who had her type of constitution. So homeopathy is not really like based on the symptom, it's based on the person. And so I just kind of like went through this book and kind of highlighted some characteristics or features of her persona. And I gave her this homeopathic remedy. And she literally like called back in a week that she'd been going to the bathroom every day. And my mind is still blown because opioid-induced constipation is really tough to treat. And could it be placebo? Totally. But that's a powerful placebo effect.
And what was the outcome of that?
So the outcome, she kept taking the remedy and she was going to the bathroom every day. And I think what we ended up doing was just increasing the remedy at some point or adjusting it in the future when it seemed to plateau and not really be as effective. But but when she was taking even the medication she was prescribed for her bowels wasn't working. I mean, on that, she was going maybe once a week, which she still was constipated. So,
Well, yeah, once a month to, daily basically is a huge change.
I mean, I had a lady once who didn't go to the bathroom for, this sounds wild, 12 weeks.
Holy cow.
That's 3 months.
Yeah. Yeah. Wow.
Yeah. Yeah. We had to actually send her to the hospital because, there was nothing else we could do for her. We tried to do everything. And she was also taking opioids she was I think she was in her 60s or early 70s, and she had fallen and I think fractured her hip or something. And so the doctor gave her some pain pills and did not give her anything for her bowels. And so she hadn't gone to the bathroom in 12 weeks. And we did everything. She'd done enema. She'd done a lot of the medications. We tried to do a Miralax bomb and flush her out, but it just came right back up out of her mouth. A little bit of stool came out as well from the top because she was so backed up. Yeah. And so we had to send her to the hospital and they had to manually disimpact her because there was nothing else to be done. And all came out, but it's just those opioids are really, the side effects. I mean, the bowel side effects are really tough sometimes.
Well, that's probably another link for the reason between chronic pain and gut dysfunction is that opioids do, for people who don't know, slow your digestive functions. So yeah, well, 12 weeks is a long time, but hopefully more people will, through this podcast, find access to people like you and be able to get help for those problems before they get that severe.
Yeah.
So you are pretty active on Instagram and other social media, and I love your posts. They're funny and educational, but they're also entertaining. So I love seeing your stuff come up. Can you tell people who may need a little bit more help besides just the things that you mentioned today, how they can get in touch with you?
Totally. So my website is just my name. So it's www.asiamuhammed.com. There are no E's in there. So it's ASIAMUHAMMAD.com. And you can get in touch with me there. I think I have like a link for email, or you can like subscribe to my email newsletter that comes out every month or so. So yeah, that's pretty much it. Instagram is just at dr.asiamuhammed. And I pretty much post a lot of mostly all actually health related content. I try to focus a lot with GI content. So if you are interested in like GI content, you might consider following that page.
Okay. And I'll put all those links in the show notes for your webpage and your Instagram handle. Now, we talked to Angela Lamb a couple of weeks ago, the producer of The Art of Natural Healing, and you are obviously one of the feature stars on that program. Can you tell us a little bit more about what you talk about in that series?
Yeah, so The Art of Natural Healing is a 3-part docuseries produced by Angela Lamb. She's a local film director here in Missouri. And we did this docuseries maybe 2 years ago, actually. And it's a 3-series docuseries. So it focuses on the gut, it focuses on inflammation, and it focuses on the environment, which are kind of 3 main drivers. My sister and I, who's also a naturopathic doctor, felt like were kind of main drivers for chronic disease. And so the 3-part series on Amazon, I think it's free if you have Amazon Prime. It's also on Tubi and a few other video streaming accounts or services. So yeah, it's a 3-part. We do like cooking demonstrations. We do naturopathic modality demonstrations like homeopathy and like some TCM, traditional Chinese medicine, which naturopathic doctors learn and are able to practice in certain states. And we do, like I said, some cooking stuff. It's focused around like art museums. It's the art of natural healing. And so we tie a little bit of art in with it as well. So it's a pretty cool docuseries, and we'd appreciate if you just check it out on Amazon Prime or wherever you find it.
Now, what are some closing thoughts that you'd like to leave for people who are listening to this episode today?
I would say, there's a lot out now about like detoxing and getting rid of toxins out of the body. Now, the thing is, most people, your liver is working fine. You don't need to add something in to do like a detox. But if you are doing one, just be aware of what the end goal is of the detox. And just, so a lot of these detoxes are just like about pooping more, but you should be pooping every day. You shouldn't need to take something to go like poop for 7 days straight. You should be pooping 7 days straight anyways, right? So think about that when you're buying into a detox. Like, what are you actually getting out of it? What's the goal? I would say, the goal for me with patients in terms of fiber is like 5 to 9 servings a day. And the serving is just a half a cup. So if you think about like a half a cup of broccoli, that's like nothing, right? So you could do, 5 to 9 servings a day. You can squeeze some berries in a smoothie. If you're doing like smoothies in the morning, you can squeeze some spinach in there. You can have like cabbage and cruciferous vegetables for dinner, and you're like easy at that 5 to 9 range. You can always do more than that. If you're adding fiber in and you're not usually somebody who consumes a ton of fiber, you want to add in about 5 grams a week until you get to your goal of fiber. The recommended fiber intake in America is like 25 grams a day, and most people don't even get half of that. I typically recommend like at least 40 grams of fiber a day. And you look at some like African countries where there's like basically no colorectal cancer or the lowest incidence, they have some of the highest fiber diets, and they're consuming like 50 grams of fiber a day, which what really bloat an American, because we don't even get like 20 grams. So don't just overnight eat like 50 grams. You're going to probably be really bloated and gassy.
Yeah, I remember talking to another GI doctor at one point, and he mentioned some like more indigenous cultures consumed up to 100 grams a day, which would just
isn't that wild when you think about what we're doing? That's like, what? Yeah, I know. Oof.
Well, thank you so much for joining us today. This is a great episode, and it's always great talking to you.
I enjoy talking crap whenever I can.
Have a great day, Asia.
You too.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice at 314-941-3970. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.